Good afternoon, and thank you for joining us for our daily briefing in the fight against COVID-19. I'm joined today by Professor Steve Powis, Medical Director of NHS England. I'd like first to update you on the facts about the spread of the coronavirus. Then I will outline why it is so critical that we continue to observe the rules on social distancing. Thirdly, I'll explain what we're doing to increase the capacity of the NHS to deal with this disease. And finally, I want to say something about how we can all work together to defeat this invisible enemy. First, the facts as they stand today. As of 9 a.m. today, a total of 183,190 people have been tested, of which 41,903 tested positive. 15,073 people in England have been admitted to hospital with COVID-19 symptoms. But the pattern of hospital admissions in England and Wales has regional differences. In London, the number of admissions fell slightly between the 1st and 2nd of April. Admissions are steady in Wales, but in Yorkshire and the North East, they've gone up by 35%. And in the Midlands, the rate of hospital admissions has gone up by 47%. 708 people have sadly lost their lives as a result of COVID-19. The highest daily total yet recorded. And that means that of those hospitalised in the UK, the number who've passed away now totals 4,313. Those numbers emphasise again the importance of maintaining social distancing measures to halt the spread of the disease. More than ever, we must stick with it, as the Prime Minister said in his video message. Now, I know that life under lockdown can be challenging, and some will be tempted on this sunny weekend to venture out and about. But, as the Health Secretary underlined yesterday, if we relax our adherence to the rules, we increase the risk for others. That's why it's so important to stay at home, to protect the NHS, and to save lives. We need to think of those on the front line and the sacrifices that they're making for us. As the Chief Nursing Officer for England reminded us yesterday, Ruth May asked us to remember two NHS nurses who died after contracting COVID-19. Arima Nasreen, who was just 36, and Amy O'Rourke, aged 39, each had 3 young children. They died while doing everything they could to help the sick and the suffering. We can all best honour them by playing our part in fighting the disease, by staying at home and slowing the spread. 7 healthcare professionals have now lost their lives to COVID-19, and we offer our heartfelt condolences to their grieving families and to the many others mourning the loss of loved ones. They include the family of Ismail Mohammed Abdul Wahab, who died aged just 13 in King's College Hospital in London. His mother and siblings are showing symptoms of the virus, and they were unable to say their final goodbyes at his funeral. In their despair, the loving, dignified tributes from Ismail's parents are truly haunting. Our thoughts today are also with the family of the 5-year-old child with underlying health conditions who's tragically died. So again, you must stay at home to protect the NHS and to save lives. Whatever the temptations this weekend, please don't go outside to visit the lakes, the beaches, the countryside. Take pride instead in keeping your own families and communities safe. The more we restrict contact, the more we slow the spread of the infection, the more time we have to build capacity in the NHS so that we can treat those who are most in need. And I want now to outline how we're increasing NHS capacity. Yesterday we were grateful to His Royal Highness the Prince of Wales, himself recently recovered from coronavirus, for opening the brand new Nightingale Hospital in East London, a testament to brilliant teamwork and determined leadership from the NHS. 2 weeks of hard work have transformed a convention hall into a fully functioning field hospital that can treat 500 COVID-19 patients on ventilators or through oxygenation. New Nightingale hospitals are due to be built in Birmingham, Bristol, Cardiff, Belfast, Glasgow, Harrogate and Manchester. And given that we know that the Midlands are a particular area of concern, the NHS and the military are accelerating their existing work to transform the National Exhibition Centre in Birmingham into a 2,000-bed Nightingale hospital. I've spoken to the Mayor of the West Midlands, Andy Street, earlier today, and he is doing all he can with the NHS to to accelerate that work. Of course, a critical part of ensuring the NHS is resilient is improving the testing of staff. 10,984 tests were administered yesterday, and as the Health Secretary outlined on Thursday, we have a strategy to increase that number to 100,000 a day. Testing is a critical part of the clinical pathway that we all follow in seeking to reduce the impact of COVID-19. But the next vital step is appropriate pharmaceutical treatment. That is why, as the Health Secretary explained, clinical trials are now taking place to see if antivirals, which have helped in the fight against HIV, and anti-malarial medicines such as hydroxychloroquine can reliably reduce the harm that the coronavirus inflicts. The next stage in the clinical pathway is ensuring that those patients with impaired lung functions get the oxygen they need, and this is where ventilation comes in. We've been working to increase ventilator capacity across the NHS. Ventilation can be non-invasive and invasive. Effective non-invasive ventilation can ensure patients do not need to be placed on invasive ventilators, where they're intubated and supported to breathe with machinery which takes oxygen direct into their lungs. We've secured new non-invasive capacity with the help of UK manufacturers who've worked at pace to develop new technologies. A team from University College London, working with Mercedes-Benz, have produced a new device which has been clinically approved. They produced 250 yesterday, will produce the same number today and tomorrow, rising to 1,000 a day next week. We're also increasing the capacity of the NHS to deploy invasive ventilation. We've been buying invasive ventilators from partners abroad, including Germany and Switzerland, and today 300 new ventilators arrived from China. I'd like to thank the Chinese government for their support in securing that capacity.